Did you know that 80% of the general population have intrusive, impulsive thoughts and images but don't have OCD or any other psychiatric condition? My name is John Burke and I'm currently in my fourth year of an undergraduate Bachelor of Science degree in Psychology in the University of Limerick. Today I'm going to talk about Obsessive Compulsive Disorder. OCD affects around 1% of the people in the world. This disorder is quite misunderstood in the general population. Often the term OCD is thrown around unconsciously without the knowledge of what OCD really is, perhaps for someone who keeps their room organised and clean. This podcast takes a cognitive approach to OCD. So what does this mean, you might ask? Well, cognition involves the internal and visible thought processes that occur in our brains. OCD occurs in individuals who have faulty or irrational ways of thinking on an extreme level. The cognitive processes in someone with OCD deal with information differently to someone who doesn't suffer from the disorder, and so their interpretation of the information becomes distorted. To be diagnosed with OCD, you must have obsessions or compulsions and they must be time-consuming. These symptoms cannot be attributable to the effects of a substance nor a medical condition. Obsessions are the recurrent thoughts and images that enter the mind and cannot be removed. These are automatic thoughts, frequent and often upsetting, for example, concerns with contamination or unwanted acts of aggression. Compulsions are the repetitive and ritualistic behaviours performed in order to avoid some sort of consequence or neutralise the obsession. These could be actions such as ritualistic cleaning and checking, or thoughts such as repeating a word or phrase, for example. OCD sufferers, importantly, are aware that these rituals are rather silly or absurd, but they still feel the urge to complete them. Cognitive dysfunction in OCD patients is characterised by their inflated sense of responsibility over outcomes. By omitting something from their ritual, they feel that harm will come to others. In their attempts to suppress the intrusive thoughts, they actually become more preoccupied with anything they feel is related to the obsession. We can describe this as the intolerance of uncertainty. Another important cognitive fault related to OCD is the thought-action fusion. This process describes how OCD sufferers blur the line between thought and action, so much so that they believe the thought is as bad as the action. A recent review of the research into emotion and cognition in OCD was conducted by Calkins, Berman and Wilhelm. As the paper points out, research demonstrates that OC severity is independent from the type and number of symptoms reported. With this in mind, the paper highlights Abramovich's Stock scale, which was developed in attempts to conceptualize OCD using a dimensional or scale approach as opposed to a categorical or type approach. The paper highlights recent empirical studies that show how the personal significance of an obsession or thought was a factor contributing to the misinterpretation of normal intrusive thoughts being important or threatening. Berman and Rackham demonstrated that OCD patients felt more distressed when the thought or obsession was about a relative or someone they perceived as helpless. This means that how important the person is to the OCD patient has a bearing on how distressing the obsession will be to the sufferer. So, what implications does this piece of research have on OCD in the real world? The study stands to inform more reliable treatment methods that are designed based on research findings. It will aid in developing more effective and safer prevention and intervention techniques for OCD. Cognitive therapy is an evolving treatment method in OCD and aims to instruct patients on how to modify their distorted thought processes to reduce their symptoms. The study outlines the cognitive model of OCD based on present research, which identifies specific dysfunctions in processes of thought associated with OCD patients, and thus enabling clinicians to target the precise fault each individual suffers from. The paper provides us with an insight into the work behind the scenes in developing a successful treatment plan for people with OCD. It gives us an understanding of the process involved when a clinician diagnoses OCD in a patient. They must identify the specific cognitive dysfunctions in each patient and test for them, along with choosing the most appropriate treatment method that suits each particular patient. The review of the literature in this paper assists in providing direction for important research that informs best practice for clinicians, allowing them to efficiently and effectively treat patients. I hope this podcast lends itself well to informing the general population about obsessive compulsive disorder. It outlines the signs and symptoms of the disease. We learned about the cognitive model and the deficiencies in the mental processes of someone suffering from OCD. A review of recent literature was described and introduced the possibility of developing more effective treatment methods with the help of evidence-based research. Overall, we have painted a bright picture for the future of OCD. However, there's still a long way to go until we can say with confidence that obsessive compulsive disorder is being dealt with as effectively and proficiently as possible.
Created using Powtoon.